Hi all. Cheers to everyone. You all know that thyroid level hormone when get increased, there will be certain complications. But do you know one thing? Decreased level of thyroid hormones leads to severe complication. That is said to be cretinism. Cretinism is a disease which mostly affects children and infants. This cretinism is mostly caused by deficiency of thyroid hormones. Okay, first of all, we can see about the history of cretinism. Do you know one thing? During 1850s, in French, cretinism was first formed. This cretinism definition is, it is a form of hypothyroidism. Hypothyroidism means the thyroid hormone level decreases. That is said to be hypothyroidism. This hypothyroidism is not only the main reason for this cretinism, iodine deficiency in diet during pregnancy. You all know that. Now only I said mostly it affects children and infants. So during pregnancy, the pregnant women know they used to take decreased level of iodine content. That is why it causes cretinism in children. Okay. So it is a form of hypothyroidism, lack of thyroid gland activity, slow mental and physical development, mostly seen in infants and children. These are all the definition of cretinism. Okay, let's see the causes of cretinism. There are three causes which I have given here. Number one, thyroid hormone deficiency. First of all, I want to tell about the hormones of thyroid gland which it produces. Thyroid gland produces three types of hormones. One is T3. T3 is said to be thyroxine. T4 is said to be tetraiodothyronine. And the other one is calcitonin. One more hormone is also there related to this thyroid gland is thyroid stimulating hormones. So these hormone deficiency may cause cretinism. Number one. Okay. Number two, abnormal development of thyroid gland. Thyroid gland development may be sometimes abnormal in genetics. So it may also cause cretinism. Number three, lack of iodine. I already said during pregnancy now, the pregnant woman intake of iodine content may less. That is why it causes cretinism. Okay. These are all the major causes of cretinism. Okay. Now we can go through the functions of thyroxine, which is a hormone. Okay. So first one is it gives linear growth. What do you mean by linear growth? It gives age by age development. That is said to be linear growth. Number two, pivotal development. It also helps in producing secondary sexual characters. Number three, brain development. Thyroid hormones helps in development of the brain. Number four, energy production. Yes, whenever thyroxine hormone level decreases, you feel little bit fatigue, little bit tiredness. Sometimes the body will be swollen. These are all the symptoms of decreased level of thyroxine hormones. Through that, you can understand your energy level decreases, right? So it also gives energy. The next one is calcium mobilization in bones. So I already said thyroxine hormone is very, very helpful in the development of bones by giving calcium mobilization. Okay. And these are all the functions of thyroxine. Okay. Now let's see the clinical features of this cretinism. How can you find an infant or a baby is affected with cretinism? Let's say the features. Number one, birth weight. So when the baby is born after delivery, the baby weight will be more than 4 kg. Okay. Number two, nasal stuffiness and discharge. Number three, macroglossia. Macroglossia means the tongue will be very larger and it will be protruded. In some cases, it will be protruded. And next one is constipation and abdominal distension. Abdominal distension, you can see in this cretinism case, mostly in the children's stomach area now, it will be little bit distended in front. That is said to be abdominal distension. Next, vomiting will be there, hypothermia will be there, peripheral sinuses will be there, non-pitching edema of limbs. What do you mean by non-pitching edema? Pitching means what in Tamil we used to say kuli villathu, like that we used to say. So pitching edema means when you use your finger or something sharp items, when you touch your hand or something else body part, it will get what? Pitch. that is really pitching edema. So non-pitching edema means when you touch forcefully or when you use some pins, there won't be any pitch. That is actually non-pitching edema of lungs. Hoarseness of voice. Voice will be a little bit hoarse. And anemia will be there. Decreased physical activity. The one more important clinical feature is neonatal jaundice. Most prominently, cretinism children are majorly affected by neonatal jaundice. Then their growth failure will be there. Okay. Stumpy fingers. The stumpy fingers. And broad hands. Very, very broad hands will be there. Dry, pale, and motile skin will be there. The skin will be dry and it will be pale. It will be cyanosed in certain conditions. And these are all the clinical features of cretinism. Okay. Next, we can see the diagnosis of cretinism. What are all the diagnostic methods? Let's see. The number one is neonatal screening. It is a technique which is used to find cretinism, who is appropriate lab and radiological test. So appropriate lab and radiological test means laboratory reports. You have seen many laboratory reports, right? So there they have given T3, T4, the values will be given. So through that values, you can find whether the values are decreased or increased. Through that, you can confirm whether cretinism is present or not. Okay. Next, you can see about imaging test. So imaging test, there are two. Number one is X-ray. So through that X-ray, if there is delayed bone age means child is affected with cretinism. That is delayed bone age. Second one is thyroid ultrasound, which consists of CT or MRI scans. Those things can be taken in imaging test. Then the next one is laboratory investigations. In this laboratory investigations, you have to find out whether in the reports there will be low T3 and T4 will be there, and high TSH, high thyroid stimulating hormone will be there. Then high serum cholesterol and carotenes will be there. Then anemia, high urinary creatinine will be there. Then ECG, while taking ECG, low voltage and bradycardia. These are all the laboratory investigations of cretinism. Okay. Now we can see the treatment of cretinism. So treatment, there is only one drug, L-thyroxine with less dose you have to give for children. In case of infants, 10 milligram per kilogram per day. Per day, 10 milligram should be given. Okay. So in case of infants, in case of children, 25 milligram per day. So you can give this. After 2 weeks, you can increase the dose little bit for an effective treatment. Next, you have to monitor the hormones through certain dietary supplements. Okay. So already we have seen the treatment of cretinism. Now we can see the prognosis. Prognosis depends on early diagnosis, proper counseling, strict diet, and careful monitoring. These are all the prognosis. And the prevention is iron supplementation. Iron supplementation is a main thing because cretinism mainly affects infants and childs during pregnancy, right? In pregnant women. So at the second trimester of pregnancy, you have to give iron supplementation. Before that, you have to diagnose whether the baby is affected with cretinism or not. Okay. And these are all the overall content of cretinism. And if you like this video, kindly support me, like my channel, share and subscribe for more videos. And I'm really thankful for this opportunity which has been made by my parents and my brother. And thank you so much. Bye.